Hi, I'm Cayla Friend from Dr. Mann's Tuesday Baptist Nassau Clinical, and today I'm going to be demonstrating an indwelling urinary catheter. The first thing that I'm going to do is check my orders, check the patient's lab values, check for any allergies, assess the patient's mobility of the lower extremities, their level of consciousness, their ability to cooperate with the procedure. I would then delegate some assistance to help me position the patient should I need. I would gather up all of my supplies, which is currently an open kit because I have used it to practice, but I understand that in a professional setting I would be opening a brand new sterile kit. For a female patient, I would have them lie on their back with their knees flexed in a frog-like position, relaxing their thighs. And for a male patient, I would have them supine with their legs extended and their thighs slightly abducted. This is my patient for today, and I put a drape underneath them just to prevent anything from getting onto their sheets, clothing, gown. And I would put another drape on top, only exposing their genitalia. So before I do the catheter, I'm just going to clean their perineal area, and with that I would use regular gloves. But before I put my gloves on and clean them, I'm going to check their armband, provide privacy, check their name and date of birth, perform hand hygiene, get privacy for the patient, closing their door, pulling a curtain if applicable, and then I would grab regular gloves, put my gloves on, drape them, get them in the correct position with my assistant if needed. I would cleanse their perineal area with soap and water, then rinse and dry the area, remove my now dirty gloves, discard them, wash my hands with soap and water, and then place my catheter kit on a clean surface and begin opening it. And at first I'm going to put on my sterile gloves. And discard of my glove paper. Next, I'm going to create a sterile field to work on. And then I am going to drape a cloth over the patient, only exposing the genital area that I'll be working with. And then I'm going to begin setting up all of my supplies. I'm going to open up my lubricant, which I will use for the last few inches of my catheter. I am going to use this to inflate the balloon once the catheter is in, but I'm going to go ahead and prep that. And now I am set up, and I'm going to begin cleaning the patient with 3 sterile swab sticks. I will use these. One of them I will use with my right hand. I'm going to clean the patient, and I'll use the swabs. One swab will go on one side from the top to bottom, the other side top to bottom, and then the last swab will go down the middle, top to bottom, and then I will use this now dirty hand. I'll use this dirty hand to secure the urethra to prepare for the catheterization. So I'm going to hold this in place with my non-dominant hand, apply the lube to my catheter, and then begin the insertion. Sorry, I'm all tangled up here, my display. I will keep sterile. My sterile hand will not be touching the patient, and my non-sterile hand will not be touching any of my now sterile supplies. So I'm gonna insert the catheter using the proper length for the gender, and then hold it in place while I inflate the balloon with the pre-filled syringe. Then after inflating the catheter, I'm going to gently pull until resistance is felt. I will secure the catheter to the inner thigh, which I do not have the proper equipment to do so. So instead I will use this clip and secure it to the patient's gown. I will position the drainage bag below the patient's bed to help gravity flow the urine in properly. I will hook it to the bed frame, and then I will clean and dry the patient. I am now done with my sterile field. I'll remove my gloves. Follow the completion protocol of the hospital. I'm gonna remove everything from the patient, cover them back up. I could observe the urine if requested from with a urine specimen right from the bag and determine their comfort level, and then just report and document any findings that I have. Thank you.